Hey, what's going on? Barnaby here. These little devices can cause great consternation. Just got an email, Doc, from my sister who is advising me to have a heart checkup based on her heart checkup because she has a bit of arrhythmia, and all of a sudden she's thinking hereditary, warning, warning, the family needs to have a heads up on that. So in this HelloLife moment, first of all, I'd like to introduce Dr. Jeffrey Chamberlain, family medicine specialist. There's a lot of heart problems out there beyond the arterial system problems with the cholesterol we've been talking about. What are some of the more prevalent at this point?
Okay. So arrhythmias or abnormal heartbeats are really common. They're out there. Another thing people talk about a lot are heart murmurs or abnormal sounds when we're listening to the heartbeat. Those are probably the two biggies that people talk about that we don't know a lot, or people don't know a lot about.
Well, let's talk about arrhythmia first. What is it?
Okay. So the heart, the beat is controlled by an electrical signal, and it starts off in one point in the atria, and it kind of spreads out from the top to the bottom to help it beat in a coordinated fashion. And there's a really complex series of things that have to happen to cause that to heartbeat in a coordinated fashion. And if any one of a million things goes wrong, then it doesn't beat in a coordinated way, and that's an arrhythmia or an abnormal rhythm to the heart.
Does the heart beat effectively if it's not firing correctly?
Sometimes it does, sometimes it doesn't. Every once in a while we all have abnormal heartbeats, so every once in a while it might not fire correctly for a beat, and that's an abnormal heartbeat you might feel, or feel a palpitation, or feel something like your heart is beating a little bit funny. Everyone has one once in a while, but if it happens a lot, it can be a problem. And then depending on how the beats are beating abnormally, that can cause problems also. So there's something called atrial fibrillation, which is really common, where the atria, the top of the heart, is kind of just beating in a not coordinated way and just kind of jittering some. The good thing about that, if there is a good thing about it, is that most of our the powers come from the ventricles. So as long as those are beating the way they should, the atria can be not working right, but the ventricles are still working, and people are still getting the blood they need in their body. There's other arrhythmias that can cause people to die, and that's the classic. The person hits the ground, and they use the paddles to shock them to get them back into a normal rhythm. So depending on what's causing the arrhythmia, can really cause a lot of problems.
Yeah, it is interesting. I have felt just that little skip of the heart, and it comes and it goes. How often should it happen where it would be of a cause for concern? I mean, if it happens once a day, go see the doc. If it happens once a month, maybe forget about it?
Yeah, it's something where it actually happens multiple times an hour in everyone, but if it's just once, it's not a big deal. Some people can notice these better than others. Actually, classically, women are a lot better at knowing when their heart's beating abnormally than men are. They're a lot better at picking it out than men are. But if it's something that just happens every once in a while, but you're not having problems, I wouldn't worry about it. But if it's something where it feels like it's more often than it should, or you're getting something on a daily basis, it probably is something worthwhile at least getting checked out so we know what it is.
Okay. And then as the blood is rushing out of the systems, there's valves, right,
Yeah.
to stop backflow. And so for that, there's something called prolapsed valves. Explain that.
Yeah. So the valves are the one-way valves where when blood flows up through it, they open up, blood flows through, and then when the top chamber squeezes, the valves close so blood can't go backwards. And a prolapsed valve is when the valve has some damage to it or problems with it, and so instead of closing like this, it kind of balloons backwards or prolapses backwards, and then some of the blood can leak backwards. And there's 4 valves in our heart. Some of the valves, if they're prolapsed, are always serious problems. Some of the valves can be prolapsed a little bit and not cause permanent problems.
Would you feel differently if you had a prolapsed valve? Would there be some sort of trigger where you'd say, boy, that doesn't feel right, I better go see a doc?
Yeah, sometimes prolapsed valves can actually cause palpitations or arrhythmias where the heart beats a little bit funny. Sometimes if it's a major problem, and the heart's not beating right, people can get really fatigued or just general problems of not feeling well, and we end up finding it out that way.
Interesting stuff, because you know what it is? Just a wonderful muscle that keeps all of us alive and well, and so we have to honor that, and it's always good to have good information about it, because the more we know about the heart, the better we can understand what it needs in order to survive and thrive. And while we're talking about knowing, you're in the right place if you'd like to share some knowledge. It's called the HelloLife Network. right here on HelloLife.net. And we ask you to share in a social media sort of a way your questions, your anecdotes, your life experiences, because we can all learn from one another. Because here at HelloLife.net, we're all about matching your commitment to a healthy lifestyle.